Yeah, no, I think contact tracing is definitely a viable part of the future. And I think as we start to have more and more connected devices that tracks more and more information, we'll have that ability, and we'll have to balance that with kind of the big brother effect of that. But I mean, if you have an iPhone, you may have seen over the last 60 days that with a new update, Apple will push out where COVID hotspots are developing in your area. So if your Apple Watch eventually can start monitoring your temperature and your heart rate and your respiratory rate, and can aggregate and track that data will be used to trend particular health issues in a community. And I suppose at some point we'll either send alerts out to communities in general, or maybe to healthcare professionals to say, hey, look, we see a hotspot developing here. And then that information will be acted upon for public health.
There's quite a few things. I could probably take up 20 minutes answering that question, but I'll try to be brief. But a couple of points I want to make is, so both Google and Apple have released libraries that allow for anonymous data gathering for proximity to other devices. And so what that enables is, for example, let's say I'm at Chuck E. Cheese. I don't know who would be there right now, but let's say I go there for a birthday party, and let's say somebody who has COVID does the manual contact tracing, and my phone detects proximity to this user. When that user goes through contact tracing process through the state health agencies, it's feasible that you could say, please notify every device that has been around this device within this period of time. And so that was actually a solution that Metova pitched to the state of Arkansas for the contact tracing solution. And it's a very viable solution using technologies that are already here. There is still some gaps in that, though, not just the detection of who you're near and for how long, which are really the two concerns when it comes to proximity related to coronavirus, but there's also the notification aspect of it. And that comes from the healthcare provider needs to notify you that you have a positive test result, but then you need to notify some type of system that you have it. And so there's a gray area between security and privacy, and if that should happen automatically, or if it should be a voluntary thing, or if the healthcare provider should be the one to say, can't your device, you're the guilty party, and notify everyone who's around you over the last 4 days for more than 5 minutes. So there's lots of technologies there that come into play. That being said, those technologies are available. They're not difficult to implement. They use some technologies called multi-peer connectivity, which have awareness through various means like Wi-Fi networks, Bluetooth, and RFID to detect who's around you and for how long. So it's a very viable solution. And there's other solutions related to contact tracing that we haven't even thought of yet that aren't related to your location. But we're about to see those come into play, I think, here in the next few months.